Hello everyone, so this tutorial is going to be on the anatomy of the ureter and we will be starting with the course of the ureter. So the ureter basically arises as a structure known as the renal pelvis, which is a funnel shaped dilatation. This funnel shaped dilatation known as the renal pelvis, it issues from the hilus of the kidney and then it descends along the medial margin of the kidney and gradually narrows as it does so. At the lower pole of the kidney, you can see that it forms the ureter proper. Now, in this particular tutorial, I'll be using various images I found on the internet, including from Netters, and I believe this is from earth.net.com. I'll be writing the references in the description. Anyways, the ureter has a length of about 25 centimeters. The upper half is found in the abdominal cavity, above the pelvic brim. So the pelvic brim is therefore a demarcation between the abdominal cavity above and the pelvic cavity below. In the abdominal cavity, the ureter is descending a bit medially and atop the transverse processes of the vertebrae and the vas major, which has its attachment on the vertebrae. Below the pelvic brim, the ureter has basically entered into the part of the pelvis known as the lesser or the true pelvis. Over here, initially, the ureter is going to be descending as well as going a bit backwards and a bit laterally, right? And in the initial portion, it's going to be following the contour of the greater sciatic notch. But once it descends to the ischial spine, it will suddenly go forwards and a bit medially to enter into the base of the bladder. In this image, you can see quite clearly. Now, at the pelvic brim, as you can see in the first image, the ureter crosses in front of the termination of the common iliac artery. In this image, you can similarly see that it is crossing in front of the termination of the common iliac artery at the pelvic brim, then entering the lesser or true pelvis, right? Basically, in this image, you can also see that initially the ureter is following the contour of the greater sciatic notch, but at the ischial spine, it suddenly turns medially and forwards to enter the base of the bladder. Now let's talk about the relations. So this is an image from Netters, and we'll be dividing the relations into the relations of the abdominal part and the relations of the pelvic part, and also the relations that can be found at round about the hilus of the kidney. Right, so starting with the relations of the abdominal part for the right side as well as for the left side, right? So for that you need to have a bit of a orientation, which is the right side and which happens to be the left side, right? That's pretty important. And just give me a second. This is the right side of the image. Let me just, yep, this is the right side of the image and this is the left side of the image. Alright. Anyways, so what is the first relation as the ureter is of the right side is descending? It is behind the third part of the duodenum. So the first anterior relation of the abdominal part of the ureter is the third part of the duodenum. And I'll be labeling the third part of the my apologies. So this is the third part of the duodenum, and you can see that the third part of the duodenum is in front, right? Because this is the demarcation of the third part. Anyway, so that's the first anterior relation. The second is the peritoneum, because the ureter is a retroperitoneal structure, and that means that it is behind the peritoneal cavity and not a part of it. Second, the third relation of the right ureter is the fact that the anterior relation includes the right colic vessels, Now the question is, what on earth is the right colic vessel? In this image, you can see the abdominal aorta, right? You can see one of its major anterior branches, the superior mesenteric artery, and the first branch of the superior mesenteric artery to the right side of the human body is the right colic vessel. And this over here, first of all, let me remove the other markers. This over here is the right colic vessel, or better yet, yep, at this point the right colic vessel is coming off, and you can clearly see that the right colic vessel is an anterior relation of the ureter. Yep, yes, it's definitely crossing in front of it. Now, third relation, what about the fourth? The fourth is the ileocolic vessels, and this is nothing to be a bit confused about. The ileocolic vessel is another branch of the superior mesenteric artery, and this also is given off towards the right of the image. This over here is the ileocolic vessel, and you can see that it is definitely an anterior relation, right? So this is definitely an anterior relation, and you can see this in this part, that it is an anterior relation. Then we have the gonadal vessels. Now the gonadal vessels are direct lateral branches of the abdominal aorta, and they are the anterior relations of not just the right ureter but also of the left ureter, right? So not just of the right ureter but also of the left ureter. And you might be confused, but let me just show you. This is basically, you can see the gonadal vessel coming off, and at this point you can see the gonadal vessel is being one of the anterior relations of the ureter, right? After this, it is said that the root of the mesentery is what you consider an anterior relation, and that makes sense. So the root of the mesentery contains the superior mesenteric artery and the superior mesenteric vein too, and I've already marked that so that you know that this is an anterior relation. Now we are left with the terminal part of the ileum as being one of the anterior relations, and that is very easy. They've cut most of the ileum, but you can see a bit of it, and this over here is an anterior relation. So we're done with the anterior relations of the ureter. Now let's talk about the posterior relations of the abdominal part. Obviously, we have the tips of the transverse processes, which unfortunately you cannot appreciate in this image. And there's also the vas major, which has its attachment on the vertebrae. And there's also a nerve, the genitofemoral nerve, right? And we are still talking about the right ureter, okay? So I'll basically label these for you. So we are starting with the vas major. So this muscle, my apologies, this muscle, and you can still see this muscle over here. This is the vas major, and you can see the ureter is descending on it, right? And what about the genitofemoral nerve? This over here is a genitofemoral nerve, and that is a posterior relation of the right ureter. Now let's talk about the left ureter. My apologies, right? Starting with the anterior relations. Again, peritoneum, because both the ureters are retroperitoneal. Again, the gonadal artery, because the gonadal arteries are given on the right and they're also given on the left. So that's nothing to be confused about. You can see quite clearly that over here, the gonadal vessels are crossing in front of the ureter. After the gonadal vessels, we have something known as the left colic vessel. And now that's very interesting. What is the left colic vessel? For that, you need to understand that this over here is the inferior mesenteric artery the third anterior branch of the abdominal aorta, and its first branch is the left colic vessel, right? Counterpart of the right colic vessel, which was an anterior relation of the right ureter. The left colic vessel is an anterior relation of this ureter. Alright. So anyways, next among the relations we have the sigmoid colon. Over here you can see that this is the descending colon, and this part is the starting of the sigmoid colon, and obviously it would have been going in front of the ureter before it terminates as the rectum, but that part has been cut off so that you may be able to appreciate the ureter more closely. Right. So there is also the sigmoid mesocolon, which is the mesentery of the sigmoid colon. It is a V-shaped mesentery, and its apex lies on the ureter. So that makes sense that the sigmoid mesocolon and the sigmoid colon would both be anterior relations. Now the posterior relations of the right and the left ureter are identical, right? So that's nothing to worry about. The right and the left relations are pretty much identical. Okay, so you can see again the vas major, the genitofemoral nerve. We cannot see the transverse processes in this particular image, right? So now let's talk about the medial relations. On the right side there is the inferior vena cava, and on the left side we have the left gonadal vein, and further medially the inferior mesenteric vein. So the medial relation of the right ureter is very obvious, so that's not a problem. This is the ureter. My bad. This is the ureter, this is still the ureter, right? And obviously the relation that is towards the left, the immediate relation, is this inferior vena cava, because that is towards the right of the body and not in the median plane as you might think. Now on the left side, just give me a second. On the left side you can see that the relation that is immediately towards the left are the left gonadal vessels and also the inferior mesenteric vein. Left gonadal vessels and the inferior mesenteric vein, and you can see the left gonadal vessels over here. Okay, let's talk about the pelvic part of the ureter. So in its downward course, the relations are as follows. We'll be considering the posterior relation, the lateral relation. So these are the important ones which we will be considering. Posteriorly, obviously there is going to be the internal iliac artery, and that is something that needs to be considered. Over here you can see that the common iliac artery terminates into the internal and into the external. So the internal iliac artery is a posterior relation. The commencement of its anterior trunk is also a posterior relation, right? The internal iliac vein, which is a counterpart vein, is also an anterior relation. The lumbosacral trunk, which is a nerve trunk, is similarly an anterior relation, and so is the sacroiliac joint. In this image you can appreciate the course in a much more better manner. And this over here is the sacroiliac joint, and that is, as you can appreciate, a posterior relation, and this is around about the region of the lumbosacral trunk emergence. In these images you can appreciate not as much as this one. You can quite easily appreciate the fact that the internal iliac artery as well as its first trunk are also considered as posterior relations. Internal iliac artery, its anterior trunk, as well as the internal iliac vein. So these are the posterior relations of the pelvic part of the ureter, which is a part that is below the pelvic brim, and we obviously know that the part above the below the pelvic brim, my apologies, is the part that corresponds to the termination of the common iliac artery. Now, what about our very important lateral relations? And you can quite appreciate it in this one, right? So, as you can see, this over here is the ureter. Right? And also, this is medial and this is lateral. So in the lateral relations, first of all, there will be the fascia that covers the important muscle, the obturator internus. There will also be the obturator internus itself, as well as its nerve, its artery, and its vein, which are related or which are found behind the peritoneum covering the lateral pelvic wall. There will also be a vein, the inferior vesical vein, and there will also be various arteries, and you can see the arteries quite clearly because these are the branches of the internal iliac artery, which is what, as you already know, which are the branches of the internal iliac artery. So another lateral relation is this one, the superior vesical artery. Then we have the middle rectal artery. So I'll repeat, superior vesical artery and the middle rectal artery. And these are the very important relations that we must be considering. Now back to what we were talking about. So lateral relations will be easier to appreciate in this image, again from Netters, right? And we're looking at the pelvis and we can see the ureter right over here. Let me just label it. And this is the relations, the lateral relations found in the pelvis, right? So first of all, you can see the obturator artery, and you can also see the obturator nerve right next to it. So obviously this is what you would call a lateral relation because this is medial and this over here is lateral, and therefore and this is the ureter. And this is the ureter, so the obturator nerve and vessels as well as the vein, which is not mentioned over here, these three are the lateral relations. Okay. Also you can see labeled over here the superior vesical artery. That is also a lateral relation because ureter is over here and this is therefore lateral to it. You cannot see the middle rectal artery over here, which is unfortunate, and you cannot see some other stuff, but most of the important lateral relations are visible. In this image over here, again, you can see quite better as opposed to the previous images that the internal iliac artery is a posterior relation in the for the pelvic part of the ureter. You can appreciate that better. This is it, right? This is it. And you can see that this is the obturator artery, which is basically coming off of the anterior part, and you can see that is a lateral relation, right? And then over here you can see the inferior vesical artery and the ureteric branch, and you can see the superior vesical artery. So these are the lateral relations. I'll repeat. The lateral relations include the obturator artery, the obturator vein, as well as the obturator nerve. It includes the superior vesical artery. It includes the middle rectal artery, which was seen in the previous image, inferior vesical vein, and the fascia covering the obturator internus. So I'm hoping this is a good image and you can appreciate a lot of this stuff. In the female, the ureter is said to form the posterior boundary of something known as the ovarian fossa. So you can see the ureter's course over here, the fact, right? You can see all of that, right? And you have to understand that it is forming the posterior boundary of the ovarian fossa in the female. Now, when we talk about the fact that upon reaching the ischial spine, it suddenly turns forwards and medially, right? We've talked about this before. During this course, when it is going forwards and medially, the relations are different between the two genders, between the male and the female, right? After this point, the relations are different for men and for women. All right. So what are the relations? Now let's talk about in the males. So in the males during this forwards and medial course, the vas deferens, aka the ductus deferens, crosses the ureter from above and goes from the lateral to the medial. So basically the ureter is crossing, so the vas deferens is crossing the ureter superiorly and is going medially. So this is not hard, and this is quite easily seen in this interesting image. So this is obviously the ureter, right? And this over here is the vas deferens. Now at this point, you can see that the vas deferens is crossing over the ureter from the lateral to the medial side, while the ureter is going forwards and medially towards the base of the bladder. If we take a look at the base of the bladder, you can see that the seminal vesicles are located below and behind the entry of the ureter. So that is the second relation of the ureter. Third point is, because this is draining into the vesicle, into the urinary bladder, the terminal part of the ureter, which is the part that is just about to terminate, is surrounded by vesical veins. So which part is surrounded? The terminal part. And this is basically the terminal part. So vesical veins are said to be surrounding the ureter in its terminal part. Now let's talk about the female. Now we are going to be talking about the relations in the female part, right? We are going to be talking about the relations in the female part. We've said that when the ureter, after reaching the ischial spine, goes forwards and medially, at that point the relations in the male and the female are vastly different. And we've talked about the relations in the male with reference to the ductus deferens crossing, and you can see that in this image over here too. And the relation to the seminal vesicle as well as the vesical veins. In the female, it's a bit difficult, and this is an image of the female body, and this is the female pelvis, right? And you can appreciate this better over here. Here you can see in white, my apologies, this connective tissue which is attaching the lateral side of the ureter, the lateral side of the uterus with the pelvic wall, right? This is the pelvic wall, part of it anyways. Now this ligament is known as the broad ligament, and I've shown just a part of it. So the first thing is that the ureter lies in the extraperitoneal connective tissue in the lower and the medial part of the broad ligament of the uterus. So this is the broad ligament of the uterus connecting the whole of the lateral part of the uterus to the lateral pelvic wall. And the ureter is present in the lower medial part of the broad ligament of the uterus, and you can quite appreciate that in this image. It is found in the lower and medial part of the broad ligament. This is the first relation in the female. The second relation is with respect to the uterine artery. In this image, you can quite clearly see the fact that the uterine artery, this is the uterine artery, is crossing the ureter from the lateral to the medial side. So this is the second relation. The first was the fact that it was present in the broad ligament. Thirdly, in this image you can see in front the urinary bladder, then you can see the cervix, and behind that the rectum and the anal canal. So the cervix has two parts, the part that protrudes into the vagina and the part that is above it. And over here you can see the supravaginal part of the cervix, this one over here. So the ureter is about 2 centimeters lateral to the supravaginal part of the cervix, and that makes sense, right? So there is a distance of about 2 centimeters in between. Now, what is the lateral fornix of the vagina? When the cervix below protrudes into the vagina, right? So there is this gap between the walls of the cervix, the outer wall of the cervix, and the inner wall of the vagina, because it is protruding into the vagina, and those are known as the fornices. And the lateral fornix is the fornix that is present laterally. So when the ureter is going to continue forwards and medially, it is eventually going to be going a little above the lateral fornix of the vagina. You cannot appreciate in this image, but I'm hoping this makes sense. So 2 centimeters lateral to the supravaginal part of the cervix and a little above the lateral fornix. Now the terminal part of the ureter will be in front of the vagina, which makes sense because it is continuously going medially and forward. So the ureter is heading medially and forward. So eventually it will be an anterior relation of the vagina. Just at near about the point it is going to enter into the base of the bladder. And again, that is easy to appreciate because you can see that at this point the ureter will be in front of the vagina, because this cervix is eventually going to enter into the vagina, and then we'll have the vagina below it. So these are the very important relations which we need to be considering. Now the blood supply. Now we're done with the relations and we'll be talking about the blood supply. The blood supply is quite important. In terms of the blood supply, we divide the ureter into 3 parts: the upper part, the lower part, the middle part, and the pelvic part. Now the upper part is this one. It's going to be supplying most of it, is going to get its blood supplied, most of it at the very least, from the renal artery, and that makes sense because this is the part closest to the kidney. And some of the branches might also come from the gonadal vessels. As for the middle part will be receiving its blood supply directly from the abdominal aorta, but might receive a couple of branches from the gonadal vessels as well as from the iliac vessels. The pelvic part will be supplied by the vesical branches, which are actually the branches to the urinary bladder, by the middle rectal branches, and by the uterine vessels. So this part will be supplied by the middle rectal artery, by the uterine artery, and by the vesical arteries. The arteries to the ureter, they lie closely attached to the peritoneum. They divide into ascending and descending branches, which first form a plexus on the surface of the ureter. As you can see, the plexus formation, and afterwards they supply it. Now, important thing to understand is that the upper and the middle part are receiving branches from the medial side, and this is an MCQ. The upper part and the middle part are receiving branches from the medial side. Obviously, this is medial and this is lateral. And the lower part is receiving branches from the lateral side, as you can see. Now, what about the nerve supply? The ureter is supplied by sympathetic from T10, T11, T12, and L1, and parasympathetics as always from the S2 to S4 segments. Again, this can come up in MCQs. In an MCQ, so you might as well try to remember it. T10, T11, T12, L1, and S2, S3, and S4. And these branches reach the ureter through the renal, the aortic, and the hypogastric plexuses. And these nerves do appear to also have a sensory function. Now, the last thing, which is also very clinically important, is the fact that while for most of its length, the ureter has a diameter of 3 millimeters, at 5 spots there are constrictions, and that is the most likely part where a ureteric stone might get lodged. And what are the locations of it? At the ureteropelvic junction, pelviureteric junction, that is where the first constriction is, at the pelvic brim, and at the uterovesical junction.